My goal is to highlight women who are doing cool things, and I think you were one of those women. Like when I was thinking about potential guests and who I'd want to feature and brands I actually love and trust, you came to mind. So
that's good to hear. I think that like when you said brand that you trust, I think that's something that was so important to me when I was starting out, especially being a doctor myself. I thought, what can I bring that's different that already exists, like in the beauty or skincare space? And so I think having that like integrity behind the brands, I always say it's kind of science backed, but cosmetically driven, is really important to me too. It's something that, I recommend to my patients that I know is safe to be using around the eyes, which is such a delicate area.
Yeah. So when it comes to your title, obviously, you're Dr. Ashley Brissette, but what do you call yourself, like a business owner? Do you a founder? What is kind of how you categorize yourself?
Yeah, that's a good question. I feel like it's changed as I've gone through this journey. So I think now I'd say surgeon and entrepreneur is kind of how I'd categorize myself. I think getting to that point of calling myself an entrepreneur was definitely a journey. I always jokingly say when I started this, I didn't really know where to start. And when I think about how I progressed in my own career as being an eye surgeon, you go to school for many years, you go to medical school, you do a residency, your fellowship, you really train to learn how to provide a service for your patients and to do surgery. And so in deciding I wanted to start a company because I had this idea, I thought, well, I don't know that I can just start it without that similar training. So I read a lot of books, I listened to a lot of podcasts, met with a lot of entrepreneurs that had started their own companies to get some insight and really advice about what to do. Because I think it was a little naive of me to think I could just start and like it would just be wildly successful because it was a good idea. I think there's a lot of good ideas that need a lot of help. So now I would definitely classify myself as surgeon and entrepreneur, but learned a lot along the way over the past number of years.
Yeah, I can imagine. I think anyone that's starting out, when you're learning to do something new, it's challenging and hard. And especially if you don't know the nuances of like packaging and product, like what it takes to actually make the product. I'm curious to know, when did you start thinking about kind of starting your business, and then when did it actually launch?
Yeah, so that's a great question. I probably started thinking about it in 2018 or 2019. So a number of years ago. And it took me about a year of just thinking about it and talking about it with only really people that I truly trusted their opinion to see, is there any merit behind this? And it seemed like there was, and people seemed interested in it. And my patients would consistently ask me, I think, especially myself being a young female surgeon, there's so many beauty trends that go around, and patients would ask me, well, what skincare products are safe to use around my eyes? And there wasn't really anything that I saw in the market that I felt comfortable recommending. We had some medical grade products, which were great for people that had acute issues. There's some cosmetic grade products, but didn't always have the best ingredients specifically formulated for the eye area. And it is a different type of tissue there. And so I thought, I should really start to think about creating something that I feel comfortable recommending to my patients. And that's how Daily Practice was born. So that was around 2018, 2019 that the idea started. And then I really started working on it in 2020 during the pandemic. And so we shut down at the hospital that I work at for COVID restrictions, right in 2020 when everything started with COVID. And I was working in the emergency department for a little while, doing callbacks for people with COVID. So I wasn't doing my normal kind of ophthalmology and my surgery that I was doing. So I had a little bit more time to dedicate to this as a project. And then that's when things really started to take off. And then we launched in 2022, July. Oh, wow. So it's been about a year since we launched. So it takes a long time to, I think, really get things implemented. And also, being a surgeon myself, a little bit of a perfectionist. And I wanted to make sure that it was a product that I believed in and that I stood behind. I think what a lot of, skincare companies do, especially if, say, it's like a celebrity skincare line, they'll do something called white label, which is where they'll meet with a lab. A lab already has a product made. They put their name on it and send it out. And for me, it was really important to have that integrity behind the brand where it was something that I truly believed in the ingredients. So I actually worked with a chemist who created a novel formula for the eyelid cleanser, which we're calling Eye Revive. And that was important to me so that I knew that the ingredients were safe and effective and that I felt really comfortable recommending it to my patients.
Yeah. I mean, when I think about my personal eye care over the years, it has not been great. I think most young people don't wash their eyes, or I mean their face even really. In college, I remember no one used to take their makeup off and just go to sleep with like eyeliner and mascara and like heavy eyeshadow. And as I've gotten older, I've become like prioritizing skincare in a different way. And when I saw Eye Revive for the first time, I was really intrigued because I felt like, well, not only is this going to help with my eye health, but it's also removing makeup, which I love.
Yeah, I think that's, people are always so surprised. You know, everyone has a skincare routine, everyone has a hair care routine, a workout routine. And when I talk to people about you need to have an eye care routine, they're always so surprised. It's like this area of our bodies that we ignore, but it's so important to us. Like your eyes say everything about you. It's how you present yourself to the world and how your eyes look and in how they feel. And it just takes one like infection or sty or redness or dryness for, you know, one episode for people to be like, I really want to start taking care of my eyes.
Yeah.
And that's exactly, that's why I called the company Daily Practice, because I thought I want it to become a part of everybody's daily practice to take care of their eyes, just like they take care of the rest of their body. So really kind of hammering home that idea of having an eye care routine and why it's important for your health.
Yeah, when it comes to daily rituals,
Yes.
I know that you're on TikTok and you often do like days in the life. And part of those I've seen is using Eye Revive.
Yeah.
And when I was thinking about this conversation and how I have implemented it in my life, I've been using it probably for about 6 months.
Yeah.
And I just can't imagine not using it now.
Yeah.
Like it is a ritual. It is a thing that I just did naturally. And if I don't use it, I feel weird.
I think that's what's so amazing to me is like hearing that positive feedback is really important, because I know scientifically that this works, and we have such great data and research behind why washing and cleansing around the closed eyelids and eyelashes every morning and night is so beneficial for eye health, for the look and the feel of your eyes, and also for your vision as you're getting older. So it's really, truly science-backed. And then hearing people say, I noticed a difference after I've been really consistent with this ritual, I think really stands out.
I actually gave a bottle to one of my friends. I don't know if it was mentioned to you, but
Yes.
I gave it to her, and then she texted me when she ran out and said, I need to buy this. Where did you get it?
That's so amazing. I love to hear that, because it's interesting starting a company like you. It's kind of like your baby. And so, you know, if someone has something negative to say or critical to say, it's like, you know, right into your heart. But when people say positive things, you know you're on the right path. And I know nothing is for everybody, but even just people taking the chance on starting to incorporate a new part of their daily routine and a part of their daily practice, I think they're really going to start to realize that it's something that they can't live without, which is like, how was I managing with this before?
Yeah. I'm curious, when it comes to the future of daily practice, what is your ultimate goal and vision? I know that you're involved with like some work in other countries, and I would love to talk about that and what that looks like for you and what is important about that work to you.
Yeah, absolutely. I think with the company, I have two specific goals. One is to continue to grow the company itself. So when I started, I was completely self-funded. I have one product. It was really just proof of concept. Like, are people interested in eye care as a classification of a part of their beauty care routine? And two, do people like the product? And over the past year, we've really seen that proof of concept come to light. And more people are starting to incorporate a daily eye care routine. So what I'd like to do with the company is to start to come out with more products that are specifically formulated for the eye area. So I'm working on that currently. So there should be some products out probably late this year, again, to kind of help to build that brand, and anything that you would think about using in and around your eye area, you know would be safe by coming to a company like Daily Practice for those products. And then the second part of the company, and you know, I think my true motivation for starting this, other than helping to promote eye care and eye health, is really to promote eye health on a global level. Because when I think about the change that I can enact at a community level in New York City where I work, you know, I see my patients, I do surgery for my patients, but I could do so much more if I could really help to grow awareness of eye health. And unfortunately, blindness is somewhat of a gendered issue. There's more women living with blindness globally than there are men. And there's a few reasons for that. One, in part, it's more difficult for women to access healthcare around the world. Often they're at home taking care of the family or the children. And two, they don't have access to the finances like maybe a more patriarchal role in the family would. And so unfortunately, there's more women that are blind globally than there are men. And there's a lot of great organizations that are helping to provide surgery globally to help restore vision to those in need. And I've worked with a few of these organizations. One is called Orbis, and another is the American Society for Cataract and Refractive Surgery. They have a foundation as well, which helps to provide services to those here in the U.S. And so, you know, in some of the work that I've done, I can see how important it is to really help to promote the concept of eye care. And what I would love to do is start a daily practice foundation where we can provide finances to these pre-existing organizations offering surgery to help them close that gender gap that exists in healthcare, especially in blindness. Already we give a portion of proceeds to foundations fighting blindness globally with the single product that I have. But what I can really envision is if we have 2 or 3 or 4 or 5 products and we're selling a lot more and we're really selling on a global level, that will just be able to fund so much more surgery around the world.
Why is there a gender disparity there? Why, is there a reason?
Yeah, there's a couple of reasons. One, we think it's because women have less access to the finances in the family. So they might not be able to access healthcare in their community because they don't have the financial ability. And then 2, they're often taking care of the children or the family at home, so they can't travel for appointments or access appointments similar to somebody else in the family or the household might be able to. And you can completely change the trajectory of somebody's life by restoring vision. I mean, every blind person takes 2 people away from the community because you need somebody to help take care of them. When I worked with Orbis, one of the first missions that I did is I went to Peru, and we were doing eye muscle surgery for kids that have turned-in eyes to help straighten their eyes, to help to improve their vision. And I was speaking with a colleague, and we were saying, for a little girl that has turned eyes or can't see, that means she's probably never going to marry. That means she's probably going to be a burden to her family over her lifetime. And so even just by doing something simple as restoring vision to her as she's a child completely changes her life. And there's no greater feeling than helping somebody see better again. And so, when I think about I can do that at a community level in New York, or if I can grow daily practice to be the really, large company that I would like it to be, we can then have so much more access to finances to help fund these surgeries globally to really enact change.
Yeah, I once watched a documentary about I don't know if it was one of these organizations, but they went to, I think, North Korea and did a bunch of cataract surgeries for both older people as well as younger. And I was surprised by how young these people were that had some vision issues. And they were talking too about it is substantial for women specifically in the marriage aspect. And if they're not married, then where is their finances coming from?
Exactly.
And it's just a different world, from what we're used to in New York City, in the US. And I think it's really impactful to think about how buying a product even could go to helping somebody's lives.
Completely. And it's so interesting you say that about cataract, because cataract is the world's leading cause of blindness, but it's reversible with a surgery. And the surgery is quite quick, about 30 minutes. It restores vision to those in need. And so when you think about, almost everybody over their lifetime develops cataract. Everybody has 2 eyes. At some point, people do lose vision. But you're right, younger people can even develop this, and it can completely change their lives. So being able to help fund surgery to help fix the world's leading cause of blindness is just really my true passion in what I hope to do in my lifetime.
That's amazing. Yeah. I love that. I just know as a consumer that when I buy a product, if it is going to something that I think is a worthy cause, which this absolutely is, it helps me feel better about where my money is going anyways, plus getting the benefit of the product actually. Something that I learned when I first started using iRevive is that, well, I didn't know what it would do, honestly. I was like, okay, I'm going to try this out and we'll see. And I noticed that it made the skin around my eyes moisturized, removes makeup. Now I don't like any other makeup remover because I know it's not technically a makeup remover in its own respect, but it does remove makeup and dirt and oil. And how do you, as when you're giving it to your patients, when you're recommending it to anybody, how would you describe it and what the formula does?
Yeah, that's a great question. So, I think just even setting the tone for why we need to be cleaning around our eyes. So the function of the eyelids and lashes is to trap all the dust, pollution, bacteria, debris, pollen, everything that exists in our environment so that it doesn't sit on the surface of the eyes. Because all that stuff really causes redness, irritation, dryness, leads to infections. And it can even lead to blurry vision or permanent vision loss. So that's why I always say to my patients, it's really important to actually be washing over your closed eyelids every morning and night to remove all that pollutant debris and that bacteria to keep your eyes healthy. And so the formula, when I was thinking about it, I thought, we have medical grade cleansers where if you have an active infection are great and work to help remove that. And then we have these cosmetic kind of makeup removers and hydrators that people use in and around the eye area, but maybe not with the best ingredients. So for daily practice, I kind of thought of it as like a 3-in-1. One where it can help to remove any residual makeup particles. So if you do a lot of glam, I usually say do like a makeup remover first. But you don't want to be leaving those chemicals around the eye area. And there's always going to be little particles left behind of the makeup. Like I see it all the time. People come in with irritation and there's little mascara or glitter particles stuck to their eyeballs. So
oh my gosh.
Yes, I see it a lot.
That kind of makes me scared of glitter because glitter does not come off.
Yes, exactly. So the first thing is it helps to remove any residual makeup. It cleanses. So it has cleansers in it which help to remove that bacteria, helps to remove the pollen and the debris that's built up throughout your day, and even the sleep crust that builds up when you kind of wake up in the morning and have that there. And
that's
then
actually the primary reason I love it as
yeah.
well.
I know a lot of my patients love it in the shower in the morning because it kind of wakes everything up in and around your eye area. And then the last thing it does is it moisturizes. So it moisturizes the eyelid skin and the eyelashes. And that's a really important part of keeping your lashes looking long and healthy as well. I mean, I see a lot of patients that abuse lash serums like a Grande lash or these things that really do help your lashes to grow but come with some nasty side effects. And I always tell patients, if you're just cleansing and naturally moisturizing the lids and lashes, you're going to find your eyes just look brighter, they look whiter, they feel more comfortable, and your lashes just naturally look better as well.
So when it comes to using the product and how it affects your eyes, because, obviously it's closed, you want to use it on closed
eyelids, yes.
I feel like it would not be great if you didn't use it on
Yeah, you
closed.
don't need to wash your eyeballs. Your eyeballs are self-cleaning, but the eyelids and lashes need to be cleaned.
That's a good clarification.
Yes.
But what does it actually do for your eyes? Is it just that it prevents things from getting in? Or does it actually do something to your eyes?
Yeah, it helps to prevent things from getting in. That's exactly right. And then it also helps to remove a lot of the bacteria and biofilms which exist on the eyelids. And the bacteria loves to live at the base of the eyelashes. It's, we have bacteria all over our skin that just naturally occurs there. But if you get an overgrowth of that and too much biofilm, that's what leads to eye redness, eye irritation, strain, dryness, blepharitis, which is inflammation on the eyelids, and even infections like styes. And so part of keeping your eyes, one, feeling comfortable so that you don't have a lot of dryness, irritation, and allergy, and two, them looking good so that you're not having a lot of redness or swollen eyelids, all comes about from that daily cleansing.
Yeah, that's great.
Yeah.
I have been telling everyone about it. I love it so much.
I tell my patients, you brush your teeth morning and night, you should be washing over your closed eyelids. We as ophthalmologists have not got that message out as well as dentists have, but I think once people start to buy into it, you really start to see a difference.
Yeah. I think what you're doing is great. I also think the mission is great, and I'm excited to see what other products that you come out with.
Yes, you'll be the first to trial them once they're available.
Yes.
Again, with my kind of whole concept of, as you mentioned, this concept of brand integrity, it's important to me that it's not just something I'm slapping my name on. I really want the ingredients to be effective and safe. And I really want to make sure that it's ready for our customer base, for my patients, and for anybody that wants to be using these products, that it's safe and effective. So as soon as it's available, you will be one of the first to trial. I promise you.
I'm excited. Do you think that most of your customer base for your product is women or men, or is it kind of a mix?
I think it's kind of a mix. I think men are starting to kind of recognize this as well. I think men in general are more prone to getting into skincare nowadays. I know at least my partner, he uses my products all the time. It's so funny. But it is a bit mixed. It's definitely more women than men. But I think the women then start to spread the message to the men about what they can do to help their own health. And I see it, in my practice, when patients come to see me, it's when it's kind of come to a head and things are feeling or looking uncomfortable for them. So I see the worst of it, but I think to try and prevent it from getting to that point where you're just naturally taking care of your eyes and your vision, this is a great place to start.
Is there anything else that you would give as far as tips or advice on how to, especially women when they're wearing makeup, how to protect your eyes just to make sure that nothing is going to get to that point?
Yeah, for sure. I kind of have my prescribed eye care routine that I recommend to everybody. So the first thing is, if you do wear makeup, make sure that you take it off. And then you want to do the cleansing. So that should be the last thing that kind of goes in and around your eye area, would be the eye revive. If you have extremely dry skin, you can always use a little bit of moisturizer as well to kind of seal it as part of your 3-step routine. I always say you don't want to put it right next to the eyeball or the eyelashes. All you have to do with the moisturizer is dab it on the bony part where you can kind of feel around the eye, and it'll absorb and go where it needs to go into the skin. If that's not enough and you're still having irritation, there's a couple other things you can add in. One are artificial tears, just to help to lubricate the surface of the eye. Really similar to how we put cream on our hands. It's a temporary measure, but it's good for the skin. It can be the same for the eyes. And then lastly, doing what's called a warm compress. So you can get like a towel that you put under warm water or an eye mask that you microwave, sit with the hot mask or towel over the closed eyelids for a couple minutes. And that heat is very soothing, and that can help to comfort the eyes as well.
Okay.
Yeah.
I'm going to try all of these.
Yeah.
I'm like, my eyes, I generally don't have problems with my eyes, but I got a sty like 2 months ago, and I've never had a sty before. I'm like, why is this hurting? What is this?
Yes, anything around the eye area is so painful. It's so it's so unsightly as well. Like people are like, what is that? Is it infected? Is it contagious? It's, so people get really nervous, and especially because it comes to your vision. It's so understandable. If something goes wrong with the vision or the eyes, it's like people get very, very nervous.
Yeah, I'm sure, because it's a very scary thing, and we're all very lucky to have our vision.
Completely. That's why when I see all these like amazing TikTok beauty trends that come out in and around the eye area, I'm always like cringing a little bit, because I'm like, we got to keep our vision safe. Like it just takes one terrible infection or something like that for people to realize like maybe this wasn't the best idea.
And you don't think about it when you're like trying it out, especially when you're like, on TikTok and maybe you're like 20 years old, you just don't think about your eyes in that way.
I know. And I mean, we're so motivated to look and feel our best. And so sometimes like a quick fix of doing something like, some lash extensions, like a DIY at-home kit to dye or curl your own lashes sounds like a great idea. But if you have a complication and it affects your vision, that's where it gets really scary.
Yeah. I am very scared of doing anything myself.
Yes.
I like once dyed my hair at home and was like, no, never again. I'm not doing this.
I know. I feel like I've seen the viral videos of people doing things online to themselves and having it like a little bit of a mishap. I feel like when it comes to your vision, you have to be so careful. I mean, I always say to my patients, if you want to try something, say like lash extensions, like I'm okay if you do it for a special occasion, go somewhere reputable, maybe do a patch test first with the glue just to make sure you're not allergic to it. There's so many ways you can try these beauty trends safely, but I would just be cautious, especially when it comes to the eyes and the vision.
Yeah, I'm just lash extensions are not for me.
Yeah.
I'm like, this seems like one, too much work, and also it just seems like annoying.
Yes.
Like it seems like it would be in my face, like just not.
I know. And it's so funny because I feel like if we learn to have these daily practices and rituals, over time we start to notice these changes in ourselves where we're just naturally looking and feeling better. It's just hard to get into the habit of doing it. And I completely understand that and appreciate it. But I always say to my patients, if you commit to cleansing over the closed eyelids like morning and night for the next number of months, you'll just see your eyes are naturally looking brighter, your lashes are naturally growing longer, and you might not have to abuse all these things to try and get the result that you want.
Yeah, I think that's a great motivator, especially if you've seen firsthand, like I have, the difference it makes. It's just like, oh, why wouldn't I do this? Why wouldn't I take care of myself in this way?
Completely.
I know you're a big person on TikTok. You do your like daily kind of thing. I watch your videos a lot.
Oh,
they
I
come
watch
up in
yours
my
too.
For You. I think actually before we met, it came up on my For You page, and I'm like, oh, this is so cool.
I think it was like destined to meet. I also feel like sometimes you post stuff on Instagram and I'm like, I was there earlier today. It's like we're following each other around the city.
That's happened a few times, and I'm like, oh, this is great. Well, thank you so much for coming on. I really appreciate it. I feel like, again, I want to highlight women who are doing really cool things. And I guess my last question is just, is there anything that you are either working on or that you've seen that you think is important to mention as far as helping people with their eye health, or if you see a trend happening that you think maybe they should avoid?
Yeah, that's a good question. I always say that it's really important to make sure that you're also going for, say, like an eye exam every couple of years, and especially if you've never had one, to have one. And the reason I say that is that the eyes aren't just the window to the soul, they're the window to your total body health. So when someone comes in for an exam for me, I can look inside your eyes and I can tell the integrity of the blood vessels. I can look for things like diabetes, high or low blood pressure. I can tell if you have autoimmune diseases or might be more prone to that. So there's a lot that can actually be told about through an eye exam. So if you have anything going on with your vision, if you haven't had an eye exam in a number of years, I think it's a really great place to start to reach out to your local ophthalmologist, just again to make sure that you're taking care of your vision and your total body health.
Yeah. I'm someone that does that. I have to. My whole family doesn't have very great vision, so I have been like on it.
Yes.
And I'm like, I was afraid to try contacts the first time even, because I'm like, oh, I don't want to like touch my eye or do anything to, like if I'm not cleaning the contacts properly, I was scared. And then once I went to an ophthalmologist and they kind of taught me how to do it, I felt like it helped me a lot.
Exactly. Like I think sometimes people are scared to come in because there's a bit of like a nervousness around the eye area.
Yeah.
But just know that it's going to be in general, like just so much better for your health and for your vision going forward to have that done. And just mention to them, like, I'm nervous, or like warn me if you're going to touch my eye or something,
Yeah.
if you're really nervous about doing it. Ophthalmologists are very nice, I promise.